Greetings from Jeevan Jyoti Society. I am Dr. Kashika Kathuria, gynecologist and infertility specialist, and I will be talking about how to manage your antenatal visits or your prenatal visits during pregnancy in this COVID pandemic. In this time of the COVID pandemic, all the women who conceive, who become pregnant, are really very worried. And I'm faced with this common question: Doctor, I don't want to go to the hospital, I don't want to go to the clinic because I feel I will get exposed. But at the same time, it is important to know that antenatal care or care and supervision during pregnancy is an essential health care. So we cannot ignore it in total. So, what can be done? What is the middle path? So, whenever a woman conceives, that is, she does a pregnancy test and she sees two lines in the pregnancy test, what does she do? She can do telephonic consultation with her doctor or her gynecologist. So, based on her previous history and looking at her risk factors, it can be decided how early she needs an ultrasound or it can be postponed. So, her pregnancy, based on her initial evaluation, will be classified as either a high risk pregnancy or a normal low risk pregnancy. For all practical purposes, if a pregnancy is low risk, it can be managed with only 4 visits to the hospital. That is, she needs to visit the hospital or the healthcare facility only 4 times in her whole 9 months of pregnancy. So, what are these times? One will be at 12 weeks. The window is from 11 to 13 plus 6 weeks. That is around completing her first 3 months. The time that she is about to complete her first 3 months. That is one visit. The second visit, which is important, is at 18 to 20 weeks, wherein it is very important to do a level 2 or an anomaly ultrasound. Then the third visit will be around 28 weeks, and the fourth visit will be around 36 weeks. So these are the physical visits to the hospitals. In all these visits, the patient will a detailed history will be taken, a detailed examination will be done, the necessary ultrasounds will be done during these visits. She will be prescribed her diet, her micronutrient supplementation, iron and calcium supplementation, and vaccination will also be done. Along with this, her the antenatal investigations which need to be done. That is, there are certain blood tests, urine tests also which need to be done during pregnancy. They can also be done in these visits itself. And important is that these are the physical visits. So in between these times, that is at regular intervals of say 2 weeks, she needs to consult her doctor telephonically. So the visits which would have happened by physically going to the healthcare facility, they can be replaced by telephonic consultations or online consultations, which will be combined with a fetal movement count, a blood pressure check at home, and also a weight check at home. So this ensures identification of any risk factors timely, and any visits that may be needed in between these times which I have told, they can be scheduled accordingly. So this particular plan is for a pregnancy which continues to be low risk throughout the pregnancy period. But however, there will be cases wherein the pregnancy may be high risk. Say, for example, patient has had an ectopic pregnancy previously. Previously, there is a history, or she has had a recurrent pregnancy loss. In that case, her first ultrasound may need to be done before the 12-week scan. So to confirm the viability of the baby, the well-being of the baby, she may need an earlier ultrasound. So, also in cases where the blood pressure may be high or the blood sugar may be high, that is, she may develop diabetes, hypertension, there may be other complications, various other complications which can be there, or she has any pre existing illnesses like kidney disease, SLE. So, these all put them at risk of complications. Or maybe when we are doing a scan or examining her clinically, the baby is not growing well. In that case, the management has to be individualized. So such a woman will need more frequent visits to the healthcare facility or to the doctor. So my message to you is that antenatal care is essential healthcare. But yes, we can modify it during this pandemic time, minimizing the number of physical visits to the doctor. And whenever there are these minor complaints of pregnancy, like there is nausea, vomiting, the patient wants to know about her diet, her supplements. So these can be very well addressed telephonically or in online consultations, avoiding physical visits to the hospital. So this per se decreases the risk of catching the COVID-19 infection. Along with that, it is very important that all pregnant women follow all the COVID-19 prevention precautions which are recommended for the general population. So, my message is that stay safe, stay healthy. The pregnancy should be supervised and it can be done with a minimum number of visits. Thank you.